My name is Ruben Halperin. I'm an internal medicine physician and currently working as the medical director for quality for Providence Health Plan. Medications are never the only answer, but in certain cases, they can be helpful additions for managing chronic pain. Because pain is magnified by many issues such as poor sleep, depression, and anxiety, medications that help with those conditions may also be useful. So what are common pain medications used for chronic pain and how effective are they?
There are several classes of medications that are used to help manage patients with pain. They include over-the-counter, anti-seizure, antidepressants, topical, muscle relaxants, cannabis, and opioids. Over-the-counter pain medications. These medications do not require a prescription. The most common medications in this class are acetaminophen, or Tylenol, and the non-steroidal anti-inflammatories such as ibuprofen, or Advil, and naproxen, or Aleve. These can be very effective for all different types of pain. Even though Tylenol, Advil, and Aleve are over-the-counter medications, that doesn't mean they can't be dangerous. Tylenol can cause liver damage, and Aleve and Advil can cause stomach ulcers and kidney damage. If you're going to take these medications on an ongoing basis for chronic pain, it's really important to discuss the dosage with your physician. Other categories of medications that are used for pain are anti-seizure medications. Many different anti-seizure, also known as anticonvulsant medications, are useful for pain. Gabapentin and pregabalin, or Lyrica, are effective for nerve pain and headaches. Antidepressants. Some types of antidepressants, especially the tricyclics like amitriptyline and the SNRIs like duloxetine, also known as Cymbalta, are used in chronic pain. These medications are commonly used for nerve pain and headaches. In patients whose depression or anxiety is making pain worse, they can be especially helpful. Additionally, some of these are very sedating and may help pain by improving sleep. Creams, gels, and other topical medications. Voltaren and other topical forms of non-steroidal anti-inflammatories, and lidocaine, a topical anesthetic, can be useful for pain localized in one area. Muscle relaxants. There are many types of muscle relaxants like Flexeril, Robaxin, or Zanaflex that people find useful for pain. They are commonly used short-term for muscle aches. Generally, they are not for long-term use. Many of them are very sedating, and they may help pain by improving sleep. Cannabis. Many people use cannabis topically, orally, and inhaled for chronic pain, especially in states like Oregon, where it's legal for medical and recreational use. Note, it remains illegal at the federal level and in many states. Opioid pain medications. Opioids are the most powerful, but also the most dangerous of the medications used in pain. Some examples are morphine, Vicodin, Dilaudid, and oxycodone. They are useful for acute or short-term pain, such as after surgery or traumatic injuries. Opioids are less effective for chronic pain because people build up a tolerance and require higher doses for the same pain relief. With long-term use, there is higher risk of dangerous side effects, including dependence, addiction, and death.
Pain medications are useful if they can lessen the severity of pain and allow the patient to work on all the other aspects of pain, such as staying active, improving mood, and improving sleep. Medications are only one part of managing complex chronic pain.
Because they carry risks, all medications should only be taken as prescribed. Work with your provider to come up with the medication plan that works the best for you with the least amount of risk. The rest of this video will focus on opioid pain medications, as they are the riskiest medications for long-term use. It's important that you have all the information you need to make safe choices. If you have been taking opioids long term, you may be dependent and experience withdrawal symptoms if you suddenly stop taking your opioids or reduce your dose too quickly. These symptoms are not life-threatening, but they can be uncomfortable. They can include diarrhea, muscle aches, increased pain, trouble sleeping, nausea and vomiting, sweating, anxiety, and feeling sad. Addiction is a change in behavior caused by the biochemical changes in the brain after continued substance use. If you feel that you might be dependent or addicted, discuss your concerns with your provider. Dependence and addiction can be treated and overcome.
How do we use opioids safely?
Never take more opioid medication than is prescribed to you. Taking too much opioid medications can cause you to stop breathing and die. Don't drink alcohol, take sedatives such as benzodiazepines like Xanax or Ativan, or muscle relaxants while taking opioids. This increases your risk of dying from an overdose. If you feel like you're becoming too sleepy or having breathing problems, call 911 right away and do not take your next dose of opioids.
How can I reduce my opioid use?
If you've been on opioids for a long time, you or your provider may want to reduce your dose or stop taking opioids completely. This is a process that we call tapering. Together, you and your provider will create a plan that helps you taper slowly to avoid serious withdrawal symptoms. Some patients may not tolerate even a slow taper. In those cases, your physician may use a prescription such as buprenorphine, also known as Suboxone, to help you get off opioids successfully.
How do I store and dispose of my opioids safely?
Always store your medicine in a safe place, away from children and pets, ideally in a locked container. Never let anyone else use your medication. Don't leave drugs that are potentially deadly loose in your medicine cabinet, since they can easily be stolen. If you have leftover pills that you aren't going to use, there are take-back programs at many drugstores where you can discard your medication safely. See the following link for a list of take-back locations in Oregon. Let's hear from some actual patients about their experiences with tapering.
We went through a gentle taper that lasted over several months. Can you tell me a little bit more about that experience?
Well, I'll say that at the beginning, it didn't feel like it was a willing or gentle taper. This was something that you wanted to do, and I wasn't totally on board. I felt like my life was going to be over, that I wasn't going to be able to do all the things that I've always been able to do. I have lived 19 years at this point on opiates. So it was really difficult for me to get on board, but I did begrudgingly, but I did it.
And your pain now is manageable?
Absolutely.
Yeah.
Absolutely. And I've gotten to the point where I've realized that not all pain is a, oh my God, moment. It's not something's really wrong. If I get a headache now, I'm not like, I have to go to the ER. I have to get some major pills. I have to do this. I have to do that. There are different ways to deal with your pain, and you just have to realize it's not there to take you out.
Yeah.
Tapering is such a journey. There's so many things you can learn from tapering about your pain experience and your physical dependence on medication, and really understanding how physical dependence works with medication and works with your pain. I needed the skills, I needed the knowledge, I needed the education around basic pain science and how pain works throughout the body to be able to do a taper and to be able to get off of medication and be able to live my life.
We've created a handout that summarizes suggestions from this video. The first page shows different medications that can help relieve pain. Page 2 explains the benefits and risks of common pain medications. Page 3 explains the benefits and risks of opioid pain medications, including how to safely store and dispose of them. And the last page is the medication table that we showed earlier in the video.
So in summary, medications are an important part of managing chronic pain, but never the only answer. There are many different types of medications. Your provider will choose the right type of medication based on your particular situation. Medications can be beneficial, but they also can carry risk and should be taken as prescribed. Be especially careful about mixing opioid pain medications with sedatives, muscle relaxants, or alcohol, as those combinations can be deadly.
If you have any questions about medications that you're taking or medications that you've heard about, please ask your physician and work together to create a program that works for you.
And remember, medications by themselves are not the only answer to chronic pain. I'm Ruben Halperin. Thank you for listening.